Hello, Mariana.
Hi,
Hi, very good afternoon to you. How are you today?
I'm good, very good. Thank you so
Thank
much.
you. No problem. Thank you very much for joining us today in the CanCare Facebook Live session that we have been conducting for every week, talking about different topics related to cancer management. How do we improve the quality of life of patients throughout this journey of recovery? And today it's truly our honor to have you here to share with us some of the common side effects relating to chemotherapy for breast cancer patients and how do we want to manage it. Okay, so this is a live sessions. So we're gonna have like audiences joining us later on. So once again, thank you very much. Maybe you can just put your slides on first.
Okay, boleh. So I will share my slide first, right?
Yep, you slide your the first slide. Okay. So, okay, hello guys, how are you guys doing today this afternoon? So welcome back everyone to our weekly Facebook Live sessions organized by CanCare, so which is a post-care organization that have a series of products and services to improve the quality of life of cancer patients. And we have been running our Facebook weekly live sessions for a while now, and those who have been following us very closely, I think you probably already know that we have talked about a different range of topics from October until now, and then we will continue on today, where we are very proud to have also invited Mariana, where she is an oncology nurse right now working in Desa Park, and she is a very experienced nurse that has graduated from one of the best hospital in Malaysia, which is University Malaya. And after that, she has also went to Dubai for like a couple of years, right? About a year, Mariana.
Yeah, 1 year plus.
Yeah, 1 year plus.
It was in Riyadh actually.
Oh, was in Riyadh. And then that's where she fall in love with oncology, and when she come back, she worked in Prince Scott Medical Center for a while, and later on, together with the center manager, has also set up the chemo daycare in Desapa Hospital. So today we are very lucky to have invited Mariana, although it is quite a last minute thing, and today it's Friday and it's one day before Deepavali, and I know that everybody is probably starting to go on leave. But thank you for still joining us, and today we really wanted to share more information that is relating to our topic today, which is side effects management on chemotherapy. So I'll pass the floor to you, Mariana. You can start your presentation. What happens is we will collect questions from the floor. So if you guys have any questions that you want to put it in, please, once again, put it into the comment section. After the end of the presentation, what happened is I'll collect some of the questions and I'll direct back to Mariana, and hopefully she will be able to help us to address and give us more insights. And yeah, okay, now I pass the floor back to you, Mariana.
Okay, thank you so much.
No problem.
Hi, good evening everyone. Again, Mariana is here. My name is Mariana binti Muhammad Ali. I was a staff nurse here in Park City Medical Center since 2017 when we start opening this department. Well, I'm going to share with you about managing the common side effect of chemotherapy for breast cancer patients. It's actually not only breast cancer patient, but most of the patients here are breast cancer patients. So I will just go through the slide with you guys. So before we talk about the side effect of chemotherapy, what is this chemotherapy actually? Why people are so afraid about the chemotherapy? People keep on saying that it's a bad thing of chemotherapy. What happened to the body when we give a chemotherapy? So I will just roughly touch about this topic. So it's actually also called cytotoxic. From the word cytotoxic, we know that it is a toxic. So it's actually a chemotherapy, it's a toxic drug used to treat a cancer. It works by killing or slowing the growth of the cancer cells. There are so many types of chemotherapy drugs. We can list up to 1,000 maybe the chemotherapy drugs. Sometimes we can give only one chemo drugs for each patient, but sometimes we can give even two or three chemo drugs combined together. So it called combination treatment. This choosing of the chemotherapy drugs will be done by doctor, depending on biopsy result, what is the stage of chemotherapy, what is the stage of cancer you have, what is the grade of the cancer that you have. It will be calculated and it will be discussed with the doctor. So why does the chemotherapy cause the side effect? Actually, chemotherapy, it works on active cells. Active cells are cells that growing and dividing so rapid, such as cancer cells. So we know the cancer cells is rapidly growing, so that's why it make one group of cancer at the breast, so you can feel the lump. So the chemotherapy can stop the cancer cell from growing and multiplying, or it can slower the growing rate. But it also damaging active healthy cells. So this is including the cells in your blood, in the mouth, in the digestive system, in the nails, in the hair. So this is all the cells that actively growing every day. We can see that the hair will grow every day, will become longer. The nails will grow every day. So this is also become aimed by the cytotoxic, by the chemotherapy. So that's why the side effect happen, because it's also damaging those healthy cells. Well, how to manage the side effect? So usually the side effect, not all people with the chemotherapy will have the side effect. Some people will have the side effect, sometimes non-side effect to the patient. So I can say it's different from each patient. Usually we start first week of chemotherapy, but it's good. Most of the side effects are temporary and we can be managed during the treatment. So there is so important message to be take note by you guys. So it is very important to tell your doctor if you plan to have medication over the counter, or you are on remedies or complement therapies, or some people they will go to sensei to buy medication. So these all need to be informed to your doctor, because some of the medication, it will worsen the side effect of chemotherapy, and sometimes it will affect how the chemotherapy affect your body, so that we don't want it to be interfere with your treatment plan. So so that's why very important for you to tell your doctor that if you have taken any medication beside the chemotherapy or beside the medication that given by the doctor. Okay, this is some of the common side effects. I can list up 10, 20 side effects, but this is most of the side effects that happen to our breast cancer patient. So usually it will be fatigue, nausea and vomiting, hair loss, mouth ulcer, and sometimes either constipation or diarrhea, depends also. So we talk about feeling tired, lack of energy, feeling fatigue. So this is the most common side effect. Most of my patients will have this side effect. It can be lasted for even weeks or months after the chemotherapy completed, and it can even start before a chemotherapy started, because the process of cancer growing in the body also will make your body fatigue. So you can feel exhausted, you feel tired, you feel sleepy, drowsy. Sometimes you become impatient, emotionally unstable. So all of this can happen because of the fatigue that you experience, especially during this chemotherapy. What should you do? You can save your energy. After a chemotherapy, you should save your energy, help your body to recover by doing less but resting more, especially on the first week of chemotherapy. So do some like exercise. Maybe before a chemotherapy, you have your normal routine exercise. So you can talk to your doctor, is it okay for you to continue the exercise? Because from my experience, patient with patient that used to exercise during chemotherapy will cope better with this fatigue. Try to get more night sleep, good night sleep, and take a nap during the day, because good night sleep will help you to manage the fatigue. Sometimes people will say, I sleep for the whole day, but I still feel fatigue, because sleeping is not releasing the fatigue. It's good sleep that helping in fatigue. Sometimes you just sleep, but you didn't get the energy to get back. Next is mouth sore or ulcers. So there is some chemotherapy drugs can cause ulcer. and sometimes it can become infection. And it's not only at the lip, at the cheek, it also can go through to your throat and into your stomach. So some patients, they may notice changes in the mouth and throat, such as you feel ulcer, you feel sore, you feel it's hard for you to swallow, you can feel that your saliva become very thick. So this is very common with chemotherapy. So what should you do? For your daily activity, you can use soft toothbrush. You can you can use twice a day, just as usual. But maybe you just use soft one. Don't use the hard toothbrush. You can use a special mouthwash. Usually, doctor will prescribe or doctor will give you some mouthwash to prevent some infection. Don't use the commercial mouthwash, such as the one in the pharmacy that contain alcohol. So it will make your mouth become more dry and irritate your mouth. So easily for you to get ulcer in your mouth. Sometimes what we practice here, we will there is some medication that we know very prone to get oral ulcer. So what happened, we offer an ice chip for the patient during the infusion of chemotherapy. So they will chew, they will suck the ice while having the chemotherapy. So the mouth become very cold on that time. So less medication will go to the mouth. So hopefully with that, it will less side effect of the oral ulcer. And especially for food, you should avoid, especially for the first week, avoid spicy, acidic food because it can aggravate the mouth sore. Next is nausea and vomiting. This is very stressful for a patient. I know this is most common side effect that my patient won't like it, and I'm sure no one like this feeling. So, but not everybody will feel sick after chemotherapy, but if they feel, it may start a few hours after treatment and it can last for many hours. Usually before a chemotherapy, doctor will prescribe some anti-nausea medication, but also for you to take home the medication, you can take home the medication, that nausea medication. It seems harmless, but with this nausea and vomiting, it can lead you to loss of appetite. You are not drinking, you are not eating well because you feel nauseated after drink. So it can lead you to dehydration. That can become a serious thing for you. So it's very important for you to manage the nausea, vomiting before it becomes worse. So we can manage it, don't worry. So you can eat small, frequent snack instead of large meal. So you are not really full, you don't have this bloated feeling because you eating full already. You can drink small amount but often, rather than you drink a lot, langsam satu big bottle after the treatment. So how you manage eating, you have to try and error. You should avoid food that usually upset your stomach. Maybe before chemotherapy, you know that when you take this food, it can cause you bloated. So you try to avoid that food at this moment. Eat slowly, chew well. It can help you to digest the food better. Try to avoid odor that bother you, such as cooking smell, perfume, or smokes. I always say to my patient that you might feel like nauseated during pregnancy, because you know that certain things, very sensitive things that trigger that feeling of the nausea. So you try to avoid that. So again, like I told you that the doctor usually will prescribe some medication to stop you from feeling sick. So you may take the anti-nausea tablet. The best to be taken regularly, especially on the first or second day of your after chemotherapy. So next is constipation and diarrhea. For some chemotherapy, the pain relief medication and anti-nausea medication, it can cause constipation and it can cause diarrhea. So if you have this constipation for more than a couple of days, you have to let the doctor know. You have to let the doctor or the nurses know. So your medication may need to be changed, or other medication can be given to relieve it. So if you have any diarrhea, it can be treated with the medication at home. But if you noted that the diarrhea become worse, the diarrhea becomes severe, so it may cause dehydration and you may need to be admitted to the hospital. maybe just for the hydration, for the supplement to be given to you, because this is quite challenging for you, you know. So if you have constipation, you should eat more high fiber food such as whole grain bread, pasta, bread, fruit, or vegetables. Sometimes drinking juice fruit also help to ease the constipation. You can try prune, apple, pear juice, but make sure you peel off the skin to prevent you from getting infection. So you should drink plenty of fluid, either warm or cold. It doesn't matter as long as you take enough fluid for yourself. So it will help you to lose the bowel if you have constipation, or it can replace the fluid loss during the diarrhea. You should get some light exercise. You eat small but frequent snack instead of very big snack, very big meals. So that can give your tummy, your digestive system a break, maybe, because you are not giving more burden to them. So if you have diarrhea, you should avoid spicy food. You should avoid fatty or fried food. Try to avoid raw food and vegetables, because fruit and vegetables, with raw food and vegetables without peeling the skin, it's prone to give you an infection because of the unhealthy and unclean food maybe. You should try snacking with clear broth or toast, biscuit and cheese, or cooked rice. Next, hair loss, the alopecia. This is the most stressing. I know most of the patients will complain this is the most stress side effect, but usually people will cope with that. So there is a few facts about hair falls due to chemotherapy. I can show it some to you. So chemotherapy does not always cause hair loss. There is some chemotherapy will cause hair loss. There is some chemotherapy will just thinning the hair, sorry. And there is some therapy doesn't affect your hair at all. So if you are due to receive such treatment, you should ask your doctor about the chances of hair loss. The hair loss can start around 2 to 4 weeks after the chemotherapy started. So, but it's a good thing that hair loss due to chemotherapy normally is temporarily. The good news is the hair loss that occurred due to chemotherapy is not permanent. It can regrow back, but the process of the regrowth of the hair will be variance. It can be different from each patient. It can start usually around 3 to 6 weeks after the end of the treatment. So before chemotherapy, what is the best thing that we can advise patients, we can advise you all to having a short haircut, so it can reduce the hair loss because of the burden of your scalp with the with the short hair, so less burden to your scalp. So it's a good thing to cut the hair before you start the chemotherapy. Okay, another thing, this is quite new things in Malaysia, scalp cooling cap. So this treatment actually quite long time been used in UK, even in Singapore, but in Malaysia, it's very new things. So it's one of the options to wear a scalp cooling cap during this time. The cap believed to slow, it's same method like the ice chip that you chew before. So the main thing is to cool down the scalp during a chemotherapy. So what happened is we attach the scalp cap to the patient half an hour before we start the chemotherapy, during the whole time of chemotherapy, and a few depends on the medication regime that we give. It can last another 1.5 hours after the chemotherapy completed. So what happened is I can share some of the example because at the moment we have 2 machines here in Park City Medical Center, and we have this machine for 1 year plus already. You can see that there is 2 patients of our patient here having the scalp cooling treatment during a chemotherapy. I'm so sorry for the sound. So this is 2 patients that using a scalp cooling therapy. The first patient, this is just my friend. The first patient is actually, the hair has become thinning. It's not fall off, all the hair fall off, but it just become a thinning. And another patient, she cut off her hair on the first cycle. And the photo here is actually on her 5th cycle of chemotherapy. So it's grown very fast. It's growing um, very fast, and what we call sekata, all the places are growing up already. So fact number 5, we can care of our hair. Hair often grow back in 2nd or 3rd month after the treatment ended. This is when we are not using any scalp cooling or the regular patient. This is what happened. The new hair may be very fine. Sometimes it become curly, and then either striated, and they come out with a different color. When the hair started to grow back, you might want to be gentle with it. Avoid too much brushing, curling, or blow drying. We advise them to use a very big comb so that we try not to burden the hair, the scalp. So you will massage the scalp with the fingertip using all the carrier oil, maybe sweet almond oil, argan oil, evening promise oil, or even wheat germ oil. So you can massage the scalp every day for several minutes to stimulate your blood circulation and prepare for the regrowth of the new hair. Plus, you can always stand by any of the, maybe you can before you start the chemotherapy, maybe you can start to find a wig or a turban. There is so many fashion that you can try. Or you can just become very beautiful like these ladies in the photo. So there is few options for you to prepare for before you start the chemotherapy. Okay, so what should you do after a chemotherapy? So make sure before you have to arrange someone to be with you after a chemotherapy, maybe for first 2 days, 2 days. So you might need some help, because sometimes after first day of chemotherapy, the certain medication that we give will make you a bit drowsy, a bit sleepy. So you might need someone to help you. You may take some small portion of food, but frequent, to prevent the bloated feeling that can trigger your nausea feeling. So again, when you give a treatment, you're given any treatment, any medication, the drugs will present in your body around 48 to 72 hours, only that. After the chemotherapy, then it will go out. It needs to go out. So usually it will go out through your urine. So you can use your toilet as usual, but I always advise my patient, after using a toilet, just close the lid of the toilet and then flush twice, just to make sure that there is no residual cytotoxic over there. And then make sure that you wash your hand with soap and water, and maybe you wash around the toilet bowl. So what should you do after a chemotherapy? You can make sure that you take medication post-chemotherapy that have been prescribed by the doctor. This is to control the side effect of the chemotherapy, such as metoclopramide for nausea and vomiting, usually been given 1 day after chemotherapy. Try not to drive immediately, or at least 1 day after chemotherapy. Again, as I said before, some medication will make you a bit drowsy, sleepy. So try to avoid all of these risks for you to be injured. Drink 2 or 3 liters per day. Drink a lot of water so that you can flush out the residual chemotherapy in your body. So when should you go to the hospital, or when you should contact your doctor? Fever. If you noted that you have fever above 38 degrees with chills and rigor, please don't take the Panadol. If you have this fever, you check your temperature more than 38, and the temperature doesn't go down, you have to go to the emergency immediately, because usually our body will tell us that they need help when they have fever. It means we know that after chemotherapy, your white blood cells, just like your soldier in your body, it will go down. Maybe it's been killed because of the chemotherapy, killing all the active cells. Remember when I told you earlier? So when we give a chemotherapy, we will kill some of the white blood cells, and the white blood cell in your body is low now. So when any germs or any bacteria came into your body, so this is how your body alert yourself that fever. So if you have fever, you might have infection. So you have to go to the emergency, you have to go to the hospital to check your blood test. And then if you have fever, maybe you need an admission, you need an booster injection for your white blood cell. So this is very important. And then if you have severe and prolonged vomiting, bleeding or unusual bruising, you have prolonged diarrhea, severe constipation, maybe it can cause you dehydration, or you have a prolonged pain, or you have difficulty breathing or shortness of breath. So this is very important for you to take note and make sure that you can catch all of this problem before it happens. So you can go to the emergency immediately. So remember, you are a survivor. Thank you. That's all from me.
Thank you, Mariana.
Thank
Can you hear me?
Yes, I can hear you.
Okay. I need to show my face for all. Just give me a second.
Boleh.
Okay, tak apa. So I think Phoebe will let me have my face later on. Okay, can. All right. Thank you. I think it was a very nice presentation, right? Short and sweet, and it's also very easy to understand. Even I myself now have a better understanding on managing some of the common side effects. Okay, so you guys can still continue to put on some of the questions that you have, and then we will try to answer you as much as possible. Now is a Q&A session. If you have any questions, we can always chat with Mariana over here because she's a very experienced oncological nurse that has managed many patients. She will definitely be able to help you to answer some of your questions. Even though we can't, we can also consult the doctors for some of the information and come back to you. So do not hesitate, to come to us right now so that you can put down some of the questions. Okay, so we have this audience. Her name is Miss Lau. She's like saying that, is it true that chemotherapy is very heaty? Because people always advise to say, take fresh coconut drink after chemotherapy. Is that true?
From my experience, it's not all patients having this problem. Some of them, they like to take a coconut drink, maybe because of they feel heaty. Again, side effect of chemotherapy is not same for all patients. Some patients, their body react like that, but you can take a coconut drink after chemotherapy. It's not a problem. There is no research saying that no, you cannot take a coconut drink.
Will that like interact with like the chemotherapy drug or something like that? No. So they can just like
consider as a drink. It's considered as fluid to be given to the patient. So
I see. So it's memang no problem if they want to like take coconut drink, then that is
yes,
fine.
memang no problem.
Okay, because just now Mariana, you were also talking about some of the common side effects like diarrhea and vomiting, right? Because I'm sure this may also affect like the sleep quality of the patients, especially kalau they happen at night and all that, right? So what would be your advice to patients, if they happen at night, they have to go to the toilet few rounds and then they already like sleep deprived. So in cases like that, how do we help them to sort of like at least get some sleep so that it doesn't quite affect their quality of life as well?
If they have the problem at the moment, for example, on the night time, they have the diarrhea, there is usually we will give anti-diarrhea together if we know that the medication that we give a higher risk for the patient to get diarrhea. So instead of we give anti-diarrhea, we also can supply patients some sleeping medication. Maybe it can help patients with sleeping, but clearly we will let them know that this is to be taken when necessary only.
But even anti-diarrhea is only when it happens, only it takes, right?
Yes.
So it's not like a preventive, like, kalau I takut then I just makan dulu and all that.
Bahaya. If you took anti-diarrhea earlier, you might have constipation later on.
Oh, okay. So there's a reverse side effect over there.
Some medication, we even supply both. Once patient started constipation, she can take the anti-diarrhea medication, anti-constipation. But once they start the diarrhea, they can take the anti-diarrhea. So we supply, and the patient need to try and I mean they have to adjust it accordingly to their symptom. But again, if they have a problem, maybe they in doubt, they should call to the hospital, maybe talk to the doctor.
But will they be able to contact doctor like kalau it happens at night, like 9-10 o'clock when they're about to sleep? So usually they will contact you yourself, or some of the hospital staff will be able to answer to them.
they can contact the hospitals, because usually we didn't give our personal number to the patients, right?
Yes, that's true.
So but again, the medication advice, how bad is it before they go to they can proceed to the emergency. If the diarrhea more than 5 times per day, for example, or more than 10 times per day, and they feel very weak, so they can come straight to the emergency.
Yeah. So it depends on the severity of the patient juga lah.
Yes.
Okay. So do you advise patients to say go to work when they're having treatment? Because some say I want to take like a break just to focus on treatment, tapi ada orang yang kata I cannot afford to not work for a period of time kan. So how do we find the balance between both?
That is the pro and cons actually. But usually if patient we always advise patient to rest, because they need a rest. Their body need a rest for recovering process. But maybe because of the working environment, maybe they didn't get enough leave. So we try to avoid. We have what we call nadir time. This is when all the blood count is low. Their soldier is low. Their white blood cell is low. So usually it will happen around day 7, day 8, until maybe second week. Usually we let them know. So this is the week that they have to be very careful not to contact with anyone who's sick. So because when they go to the work, they open the opportunity for them to get infection sebenarnya.
So the exposure lah maknanya.
Yes. But we are not saying that you have to stay at home. No, you still can go, but of course, this MCO you have to stay here at home.
Betul, because the risk is usually higher kan.
Yes. And again, this era now, COVID-19 era, our cancer patient is higher risk to get to get infected by any virus, because we know that the immune system of our patient is low. So and this COVID-19 or this flu and whatever it is, very prone to go to this low immune system patients. So usually we ask them to rest at home.
Okay, I see. Okay. There's also questions like, Mariana, you were talking just now about hair loss being one of the most distressing side effect. So, I mean, for so many patients that we have seen so far, right? Like, how many of them, like maybe out of 10, that come to you and say she's very worried about hair loss? I guess majority of them are female lah. Like, is there any way that they can prevent, or can they don't go for chemotherapy at all? Because I do see patients that tell the doctor, can I don't go for chemotherapy or not, or I take some other things because I tak boleh lose my hair lah. So how do you advise patient at that time, when they have this kind of fear?
I have a few patients that having this stigma, maybe this dilemma, I can say, because there is medication that can be chosen, that not making hair drop. So usually we will advise patient, like us here in Park City, we have the scalp pulling machine. So we will advise patient, the scalp pulling machine is actually they can control the hair loss. They say the recovery, the regrowth hair are very fast after the scalp using a scalp pulling machine. But again, for some patients, they are not really keen to use the scalp pulling machine, maybe because of the financial, or maybe because of the how they cope with the scalp pulling. So they prone to not using the scalp pulling. So usually I will advise them, maybe you have to stand by with the wigs, for example, cut the hair short before we start chemotherapy, stand by with the turban. We can give some samples to them. But usually I try to advise my patient to use the scalp pulling, because I really like to see the good benefit of the scalp pulling machine to my patient. Really, I enjoy.
I see. But we've talked about the scalp cool. I mean, Miss Lau, she also has a question. She's like saying that, Mariana, you've been talking about scalp cool. How does scalp cool work to reduce hair loss? Because is it like cooling the scalp, or how does that work?
Okay, the scalp cooling actually will be attached to the patient. We have a cap. They put on the patient's scalp. We will start the cooling sensation. I think the temperature will go down around 18 to 22, if I'm not mistaken. The temperature is not too cold. It's not too cold. It's just like it's run the coolant through the scalp inside the cap.
Yes.
So we make the scalp cold. So when the scalp cold, the blood vessel there will be constrict. So when we give a chemotherapy, there is less chemotherapy drugs will go to the scalp. So it can save the scalp from damage because of the chemotherapy.
I see.
Because we know that the chemotherapy will go attack to the very rapid cells.
Yep.
And hair is one of the most rapid cells in our body.
I see.
So we try to save that, but the common, what happens is when we start the scalp cooling, it's cold. So and it will be start half an hour before chemotherapy. So for example, chemotherapy will take 1 hour. So 1 hour after, during chemotherapy and another 1.5 hours after chemotherapy. So this is the time that sometimes patient rasa sejuk, but not that bad lah feeling lah. Usually we will supply with the Panadol first, maybe pre-medication, just to prevent them from cold, from headache, something like that.
And then blanket and hot drink kalau yes.
Of course. Sometimes double blanket also they will ask for.
Yeah, but I guess it's actually a very, I mean, it's definitely a valid options in that sense if they do not want to go for weak or head turn and things like that. Scalp cool can be an option for patient as well. And I'm glad that, you know, Desa Park actually do have it in that sense. So it is a service available for cancer patients. If they are, you know, have fear of hair loss, they can always contact Desa Park for more information in this case.
Yes, we will advise them to do.
There's questions from Ms. Chua over here. She's like saying that what kind of diet do you advise patients to take during chemotherapy? Well, I think this is a very, very common question that everyone will probably the first question to ask is apa yang saya boleh makan dan apa yang saya tak boleh makan. So is there any pantang food that we cannot take? Or
I don't like to hear that this pantang food. Whenever patient came to me kan, I never eat ayam after my
yes, betul.
I never eat. Because they say I cannot eat ayam, I cannot eat this. So what happened? You become vegetarian. Actually, diet is one of the main role for our patient for recovering process. What we always advise patient, we advise high protein diet because protein will be needed for our body to recovering. High protein diet, less oily food. Because oil usually will disturb the stomach, upset.
I see.
High calorie diet.
High calorie?
Yeah.
Like rice? Is rice high calorie?
Yes, but depends also. You can advise them to take brown rice maybe because our body actually recovering process, they need extra energy, they need extra protein for them to recover. So usually I will advise them don't pantang too much.
Because I think the chicken punya myth, right, is because they say nowadays chicken got a lot of hormone, the growth hormone.
Yes.
So if they eat chicken,
you can always take the breast side, maybe organic chicken or kampung chicken also can.
Yes.
But
so that
always, patient always avoid eating chicken and telur. I think.
Is it telur juga lah?
Yes, but telur is a very good source of protein.
Okay. So they have to eat the masak punya telur, right? It's not the half-boiled egg.
Yes, all the food that they need to take is well cooked. Even steak, if they want to take a steak, well cooked steak, they cannot take partially food atau tak masak punya because all this uncooked food is contain bacteria, and we know that they are very prone to get infection. So the infection may start from the stomach.
I see. Oh, infection usually start from the stomach. Huh?
Maybe it can be one of the source of infection when they took something with the bacteria.
Okay. I think maybe towards the end of our discussion today, right, we have just one more questions to ask.
Okay.
So we are saying that like diarrhea patients and patients who have vomiting and all that, usually they have dehydration or maybe they don't have enough like food intake or nutrients. So is it advisable for them to maybe take supplements and stuff like that, or kalau like langsung tak ada what do you call it, appetite to eat at all, so it's like how lah?
Supplement is actually depends on what supplement. Like for example, there is some milk that provides.
Yes, the apa ni? Those meal replacement. Betul.
Yes, it's a protein replacement for the patient. They can take they can take it, but for supplements such as tablet vitamin, tablet vitamin C, that one you need to clarify with the doctor. For supplement that from tablet, from pharmacy that they took outside, they need to go through their doctor because supplement from milk, for example, is common for the patient because we need extra protein at the moment.
Okay.
We know that the patient having diarrhea, the dehydration or something like that. But again, depends on patient's tolerance lah, because sometimes they cannot cope with the mixed feeling.
Oh, okay. Why is like vitamin C and all that? Because is there like a reason they will interact with the chemotherapy or something?
There is new research, or my doctor told me, because some of our patients that having low hemoglobin, for example, when they come for the chemotherapy, our doctor doesn't really want to add on with the supplement of to increase their hemoglobin. So it should be taken through the food, for example, from the high protein diet or the food, because there is some research done that saying that interaction between chemotherapy treatment and the supplement given is there is some interaction happen.
I see. Okay,
so I think any supplement need to be go through to their doctor.
Correct. So I think the key takeaway over here is that kalau nak take apa-apa supplement, it's best to consult doctor dulu lah. Because I think everybody punya situation is different. Some people probably will need certain supplements, but some may be like adverse event that sense lah. Okay. So I think thank you very much, Madiana, for your sharing session today. So I think what we have learned is that while sometimes we know that the chemotherapy side effects can be pretty much worrisome, and then we may thought that the side effects can be quite tough for many of the cancer patients. But what we learned today is that from Madiana is that for every common side effects that breast cancer patients have, or even that general cancer patients have, there's always a way to manage, right?
Yes.
So there's always medication, there is always even preventive measure, or even trying to have like symptomatic measure for you. So the thing is, do not because of the fear of side effects and try to say, can I don't go for chemotherapy? Even as much as like hair loss and all that, there's now so many options available, and even have like new technology like scalp cool that can help patients to prevent some degree of hair loss, as well as to get their hair back as well. So there's a lot more that we are still right now doing in the oncology to make sure that we can help you to improve the quality of life while you're still having treatment. So I think this is one of the key takeaways that I'm getting today, and some of the questions that we actually got from our audiences as well. So once again, thank you very much, Madiana, for joining us today.
Thank you for inviting me.
No problem. Yeah, and for the rest of the people, stay tuned for our weekly live Facebook sharing. Next week, we are going to talk about skincare, which is going to be another interesting topic, especially, even for cancer patients, there's still quite a lot of things that we can do to make sure that we can appear more cheerful and bright as well. Okay, stay tuned, everybody. And for those who are celebrating Deepawali, happy Deepawali to you. And for the rest, happy weekend, and see you guys next week. Bye. Thank you so much, Madiana. Thank you so much.
Bye. Thank you.
Bye.
Bye.